and a very brief and on time. So with this, I'd like to hand over the session to Dr. Das, and she'll continue further. Thank you so much, everyone.
Thank you, Archana, for hosting the session beautifully. Now we had came into the last league of our today's session. That is a panel discussion that is on challenges in dentistry as a profession in India. So for this panel discussion, I would like to request once again Dr. Sharat Shetty sir as a moderator and our specialist, our faculties as a panelist, Dr. Supreeth, Dr. Tushar Chawla, Dr. Vishwas Puranik, sir, Dr. Charubala ma'am, and Dr. Vinod Singh sir to join the session as a panel.
Really excellent presentations by the experts in their domain, and in the time given, they did justice to what a 3-hour session can allow us to do it. And it highlighted the necessary aspects of successful yet a very safe dental facility. And as Plato says that a wise man speaks because he has something to say, and a fool speaks because he has to say something. And that's why we have constructed this panel discussion where one great piece of advice is worth a dozen opinions. So in the absence of many definitive information, we tend to leap to the worst scenario. So we thought that this panel discussion will help us to achieve clarity of what is known versus what is speculation or even exaggeration. We are sure that the inputs will throw light on some of the vexing problems we as dentists face in our country. And that is why the theme is Challenges in Dentistry as a Profession in India. And I welcome and thank our distinguished panelists, as told to me, Dr. Charubala, Pavan, Dr. Vishwas Puranik, Dr. Supreeth, Dr. Vinod Singh, and of course, anybody else who would wish to join. And based on some of the inputs that we received by the attendees, I will initiate these panel discussions, and I'll throw questions to specific panelists who can answer this in a couple of minutes so that we can take up as many questions as possible. So if I can have Dr. Charubala. So there are numerous challenges in running a dental practice, such as technological shifts, patient expectations, and an ever-evolving economic landscape. And you can see that you can add many things once you open your dental practice, but the only thing that you can't change unless you move out is the dental office location. So Dr. Charubala, how important is the location of a clinic, considering it's in a big city, a smaller town, or a rural area?
Okay, thank you for the question, Dr. Sharat Shetty, sir. The first thing is there are certain common points which are important for locations, irrespective of whether you're practicing in a rural area or a small town or in a big city. First thing, most importantly, is that as we are approaching 2050, almost 20% of India's population is going to be geriatric. We don't think of this very often, but we have to see to it that the facility where we are practicing has to have a lift, has to have a ramp, has to have wheelchairs, wheelchair access. So these are some important points when we're thinking of location or where we want to have our clinic. That's the first thing. Second thing is the demographics. Supposing we are having an implant practice and we are practicing in a place which cannot afford implant dentistry, then the purpose is lost. Third thing which is very important, which is common for all facilities, I would like to start with that, is parking area. We have to have space for parking whenever there are patients. Otherwise, there's always an issue, because if we are in a crowded place, this becomes a challenge. Now, coming to rural versus small town versus big city, rural things have their own challenges. First thing is we have to be close to a bus stop or a railway station so that patients can easily come. Second thing is, many times rural areas are so cut off that access to good dental laboratories, after sales services of equipment, as well as dental dealers becomes a challenge. So this is something we have to keep in mind when we are choosing the location. Also, the commute for the dentist. The dentist may not stay exactly in that particular village. He may be coming from somewhere to do it. So that should not be like he's, traveling 20 kilometers up and 20 kilometers down every day. That becomes really hard. So that's one thing. Then if you're thinking of small towns and bigger cities, the small towns, they have an advantage that unlike bigger cities, it's a little more affordable to have a setup in a smaller town. So spaciousness could be something you can think of when you're thinking of location. For example, in bigger cities, when you're thinking of spaciousness, you will probably have to compromise on having having your place in the second floor or the third floor versus having it on the ground floor. Also, you would want to keep it in a residential area so that you can have demarcated locations. We had a very interesting conversation on design. So demarcated locations for infection control, for your plaster pouring, for your reception area, for your clinical area, etc. So location makes a difference about that. For bigger cities, the biggest challenge is the number of dentists who are practicing. In the same apartment complex, you could have 6 dentists. So you have to see to it that the dentist to patient ratio is such that you can at least sustain. So I think these are some points we would like to think about when we're thinking of location of a dental clinic. Thank you.
Yeah, I think Charubala, I think India being a big country and we have so many challenges from rural. Of course, I think in a small nutshell, you have found out what are the limitations of having location-based practices. Having said that, standalone practitioners now they do face a lot of startup hiccups. Like for example, you have a study loan and a new investment that you have to put into the place. So Dr. Supreeth, is group practice the future, and your comments on its pros and cons?
Thank you, sir. Thank you for the question, sir. So I'll just brief regarding both the private practice standalone as well as the group practice. A few points here is, of course, we understand that standalone practices are having a lot of startup challenges, finances, overhead, and patient acquisition. The third one is very important, sir, because in spite of putting so much of finances, patient acquisition is the biggest challenge what the standalone practitioners have. But then it also has its own benefits, which is full autonomy on the case. There's a very personalized patient care and potential for higher income. That is also there in a standalone. But then having said that, these days, because of a lot of group practices, which could be the future of dentistry, because there is pooling of resources and individual financial burdens are less, and there is a sharing of administrative responsibilities. So this is the advantage of the group practices. And also in this collaboration of dentists to the this makes the dentist focus more on the patient care than the business side of how to run the practice. Some of the pros of group practice, if we can just summarize. So it's a shared financial and administrative responsibilities. It has a better work-to-life balance, where with shared duties the dentist can achieve better work-life balance, less of burnout, and improved job satisfaction. In terms of access to a broader range of expertise, group practices often will include multiple specialties under one roof, which provides a more comprehensive care and attracting more patients. In terms of economy, it can leverage bulk purchasing for supplies and equipment, reducing costs. But then this is the lot of advantages of group practices, but then it also has its own downsides. The cons of the group practice is less autonomy. That means the dentist in the group practice might have less control over the clinical and business decisions compared to running their own practice. And the potential for conflicts in the group practices, because they're working closely with the partners, can lead to disagreements and conflicts which need to be managed very, very effectively. Then when it comes to the cons of group practice, profit sharing, income is shared among all the partners, which might affect individual earnings as well. So in conclusion, what we can say is, while standalone private practice offers unique benefits like autonomy over the cases, personalized patient care, group practices addresses many of the financial and administrative challenges. So it makes it increasingly popular and sustainable model for the future of dentistry. The choice between the two depends on individual preference and the career goals. Thank you, sir.
Of course, I think you have put us on a crossroad to make those choices. I think individual who starts will listen to what you have said and make their judicious opinions about what to do, because both of them seem to have their own advantages and limitations. I would not say disadvantage, but we can cope up with them as we see in many parts of countries outside India. Thanks for your input, sir.
Thank you, sir.
Going ahead from here, I see that today's environment is challenging for attracting new and retaining existing patients. How would you, Dr. Vishwas, guide these newcomers to market themselves and their services, keeping in Indian laws in mind?
First of all, sorry that I could not complete my lecture because there is an internet problem. It's okay. Now, attracting new patients and retaining old patients is a very, very important topic, you can say. First and most important thing is that mouth-to-mouth publicity is the most important thing. If you can talk well, if you can convince well, if you can do good work with the patients, and if you have a good social attachment, then new patients will go on coming. There are so many clinics in Mumbai and around, or you can say in the bigger cities, where the clinics are on the 5th floor, 6th floor, 8th floor, 10th floors. And it is not necessary that it should be ground floor. Still, patients are flowing over there because of the mouth-to-mouth publicity. Because one patient, if you treated well, he always said that this doctor is good, that doctor is good, you must go to doctor. His relatives will go. So that is a one way of doing it. So it is a must for everybody that we should have a good practice and we should have a good communication. Apart from that, you have to have a social connections, like you have to have a Rotary, Lions, JCs, then Senior Citizens Club. Then you go to the schools also, school examination, have a teachers meeting, and go on telling them the importance of the teeth. Most of the time, this dentistry is neglected. Nobody knows. The children's, the teachers, and the senior citizens, nobody knows about it. Senior citizens say that I am now 80 years old, I am 75 years old, the teeth are not required. The children's always feel, the parents feel that children, they don't require because there are new teeth are going to come. So all these things you have to convince to the patient. And the only way of convincing such type of thing is you have to have a social media with you. You go on talking with the patient, you go on talking in the school, you go on the senior citizens club. There are a number of ways of going to the police stations, because you have to assemble all police people. They are having the bad habits and the bad teeth. All the police people are having this, you can say this mawa and everything, where you have to go and talk with the people. And then once you talk all these things, you listen. When I was an IDA president of the local branch, Dombili, small branch, I used to have all these things be meeting. And that is how you get popularity also, you get patients also. And one way you are giving knowledge to the patient, what dentistry is, importance of the dentistry. So this type of things are IDA is taking, you take advantage of things. And if you hold a post or if you don't hold a post, you all concentrate on this. So you can have a good new patients also. At the same time, you will get a, you can retain old patients also. That is what is important thing.
Yeah, thank you,
What is
Dr.
required is 88% soft skill and 12% is a remaining skill, you know. But the 88% soft skill is the most important thing in your practice. Thank you.
Dr. Vishwas, I think makes a very valid point that don't be the frog in the well, come out of it. But of course, you need to be known for your good work rather than just having social skills of marketing yourself. Thanks for those inputs, Doctor. I also see that some dentists find themselves seeking employment outside dental field. I mean, I've seen so often, for example, they are into sales, marketing, administration, and unrelated sectors. Now, what it leads to is suboptimal salaries, underutilization of their skills they have learned, and of course, job dissatisfaction. What are your findings and scope for these non-clinical careers, Dr. Vinod? Am I having Dr. Vinod?
You are muted, Vinod.
Okay, sorry. Yes.
Did
So,
you hear my question anyways?
yes, I got the question. Thank you. So, see, back in the days, we didn't have proper guidance as to what to do after dentistry, to be honest with you. Okay. And in fact, in our dental colleges also, there was no counseling section as such, who would probably guide the outgoing students to tell them as to what are the options available, you know, in front of you. You either go for higher studies or you open up a clinic. Now, to open up a clinic, again, you cannot really just go out there and find a space and then open a clinic on your own, because there's nothing that you know by then. Okay. So I believe once you're out of the dentistry, that forms as a base for you, so that you can probably either go on the higher studies in dentistry, or you can probably take that as a base and then go into the management or the hospital administration part. Now you can be in healthcare IT, you can go to hospital marketing, you can go to hospital administration after the completion of a post-graduation in management course. People end up going into unrelated sectors. When I say unrelated sectors, I'm talking about non-healthcare sectors, okay? Because hospital management is still a healthcare sector. people end up going in unrelated sectors mainly due to lack of guidance. And there's no counseling as such that you will find anywhere for that matter. So this results in people taking a step in the wrong direction, I would say. And once you're away from the clinical practice, it's not that easy for you to come back, as sometimes it's just not worth the time and effort that it needs. And you really cannot be depending on having an undergraduate degree and then just think about setting up a clinic, because it takes time for you to make a name for yourself. Okay, so the next best option would be to take that degree as a base and then probably get into the administration part. Okay, or you can probably go into healthcare IT part, because even in these sectors, having a BDS and MBBS degree is a base wherein people with these degrees are much more preferred than having a non-healthcare background. Okay, and these people end up getting better job prospects and probably better designation than the non-healthcare background counterparts. So I believe a proper guidance is something that should start right from the time somebody graduates from the dental college. And I believe a counseling session for the outgoing students will help a lot for them to take the step in the right direction.
Yeah, thank you. I think it is a big requirement for us to incorporate career building information to our things, and I think it should be taken strongly by people who are in charge of policy making. Thank you for your inputs, Doc. I also see that with constantly evolving technologies and treatment modalities, dental professionals need to invest in continuous professional development to stay updated and to enhance their skills. But it's a challenge to find the right course, managing time and sometimes the cost, especially from far-flung places where these don't happen. Your views and guidance on compulsory updating with points, Dr. Supreeth.
Sir, with the evolving technologies and treatment modalities, I think it's a huge challenge for anyone to find the right course, managing the time, as well as especially for the people who are practicing in remote areas. And we need to be updated for a better patient care. So I would put it as, and the importance of CPD is because, patients trust dentists who are knowledgeable about the latest advancements. Some of the challenge which I can list down, sir, is number one is finding the right course. We cannot identify which is relevant, which is high quality course, which can be a challenge. Then coming to the time management, the balancing the professional responsibility with the CPD requirements is very demanding. Cost of the courses, which could be a barrier, especially in the remote case areas. Then the accessibility, dentists in remote locations might have limited access for training and learning better. Now, some of the solutions which probably could be hypothetical, sir. I think online learning, online courses and webinars can make it much more accessible and very cost effective. We can flex the scheduling of the time as well. Financial assistance, I don't know how much this can be implemented. Probably subsidies or scholarships can make it much more affordable. Much easier would be local workshops, local CPD workshops, which reduces the travel time, and it can also support some community learning. I think these could be some of the solutions for to finding the right CPDs.
Yeah, but I think the professional development is mandatory because we need to protect and safeguard the patients. And that's why I think one of the things which I liked was the online educational programs by accredited members. I mean, it could not be any member. And of course, handing over those points to those guys so that they can avail and access it easily from any far-flung place. Thanks for those inputs. Dr. Vishwas, with consumer protection and medical legal liabilities, and of course, you really did a very emphatic presentations on what a dentist should know. But what is reality is that clinicians and practices are facing medical legal things in spite of taking good care. So do you think indemnity insurance is necessary to ward off litigations, libel, slander, fraudulence, and so forth? Can you give us some tips on that?
Yeah, it is the cases, medical legal cases are increasing. They say that out of 10 patients, 6 patients have become medical legal now. Medical legal problems are increasing day by day. It is not only medical, it is the dental problems are increasing. There are so many cases on dental people. And that is the reason you should have a indemnity insurance. Previously, when we started practice, we have to have indemnity insurance of 2 lakhs, 3 lakhs only. But the way now cases are increasing, the way amount is increasing, they say that any medical legal case in dentistry starts from 10 lakhs rupees to 60 lakhs, 70 lakhs rupees. And if it is a hospital, it starts from 50 lakhs rupees to 2 crores, 5 crores rupees. So any indemnity insurance which we are going to take, it should be at least of 50 lakhs rupees. That is what my suggestion is. Once you are thinking of taking medical indemnity insurance, you should think that what is the premium of it and what is the coverage of it. That is most important thing. Some of the indemnity insurance are not covering for the aesthetic dentistry or implants or something like that, or the criminal cases also they are not covering. So when you are thinking of insurance, you must study all these things. How much, what are the coverages there? What are the exclusion clauses there? All insurance policies having exclusion clause that they don't disclose. When agent comes to you, he will not talk anything about the exclusion clause. So you must emphasize on it that what are the exclusion clauses of it, and see the premium also, and try to have at least every dentist should have 50%, 50 lakhs rupees of insurance. One thing you should remember, taking 50 lakhs rupees insurance, that doesn't mean you can do whatever you want to do and not thinking of any legal things or not legal things. It is a medical legal thing. You must think of everything. Above and all, if anything happens, then only there are chances that insurance policy may cover. There are so many plus and minus point about it, because the lawyer's appointment of the insurance policy of indemnity insurance is totally different. The case presentation, what way the things has happened, that also the thing. So as far as possible, they try to avoid it, avoid the giving to the facilities to the, but it is a must. Because one way or other, it might help you, because the 50 lakhs rupees, 60 lakhs rupees is beyond our capacity. But see that always prevention is better than the. Thank you.
Yeah, well said, Dr. Vishwas. I think making sure that you don't entangle into medical legal things, because you do all things well in your office, maintain records well, and of course, primarily do good work in your office. I think you'll be far away from those situations. But of course, there are people waiting in the shadows to put cases against you, and you need to fight them. And that's why the indemnity policies. Of course, there are nuances which I think Dr. Puranik can extend in his chat answers whenever you put across it. Thanks, Dr. Vishwas, for such a wonderful reply. Dental diseases are complicating many medical conditions, yet medical referrals to dentists are the lowest, and this lack of support from the physician is disappointing, according to me. Dr. Vinod, would you want to throw some light on how we can change this scenario, considering that both dental and medical diseases are connected to each other?
Yes, thank you. So I'll tell you from my experience of managing hospitals point of view. In hospitals, you will see that there is a marketing team. There's a marketing manager, then there are marketing executives. The job of these marketing executives is to go out and meet the general practitioners, go out and meet other specialists who are not there in their hospital, and ask them to refer the cases. Now, we don't see similar thing in a dental clinic business as such, because you probably won't keep that additional marketing executive. Maybe because of the fact that you might feel that you don't need it. Okay. But in case of hospital, I'll give an example that, let's say your clinic is within the hospital. You have a dental clinic within the hospital. We call it as DIH model, department in hospital model, wherein let's say a dentist approaches the hospital and says that, we will probably take care of the dental department of your hospital. Maybe we'll put 1 or 2 dental chairs. You just give us a space, and then we will take care of the manpower, the administration of that, and even the equipments. Now, the beauty is that however the walk-in patients that you have from your own practice, they will come there. Number 2, the general patients visiting the hospital, They will also be able to visit you. Number 3, the general physician and other doctors can also refer the cases to you because you are within the same setup, within the same physical building. You see here the distance between the referring physician and the dentist has come down drastically. There's no fear of the patient going somewhere else after being referred to a dental clinic. So the first and biggest criteria I would believe is shortening the distance between the referring physician and the dentist. Number 1. Number 2 would be, if you have a standalone clinic, you have to focus on the hospitals that are close by, maybe in a distance of say about 2 kilometers on all the, okay, 2 kilometers distance. So that way the distance is much lesser so that the physician can refer the cases to you. And also you have to have a marketing executive. Now, without having any marketing executive, I mean, I don't expect the dentist who's working from morning to evening for him to go out there and then probably approach the doctors and approach the hospital and ask them for referral. That's not going to happen. Okay. But if in order to, have increased sales, you need to have somebody in the sales and marketing team. At least one guy, just as a pilot project. If anybody feels that, there's not much of referral happening, then I would suggest that as a pilot project, take up a marketing executive. His job is just to reach out to these hospitals which are in the vicinity, in the neighborhood, and then maybe find out how many general physicians in that hospital is there, and then probably in the neighborhood, how many general physician clinics are there, how many people practice in the evening. So you have a database of say around 30 to 40 general physicians. Okay. Now this person has to go to them, follow up on a regular basis, and that's how the referral cases will start coming in. You also can go to cardiovascular cardiologist. You can go to urologist because there's dental halitosis, I believe, and other dental problems. Then you can also go to diabetic, general physician who practice diabetology, because then again, swollen gum and other dental problems might be there. So you already have the patient base ready. It's just that people are not really reaching out to them. Correct. So my suggestion would be to go out and treat it like, a sales and marketing expert or executive is required in order to tap that business.
Yeah, thank you. I think what we are basing in our country is those connects. And I think you have well summarized that. How do we reach out to these guys, bring an awareness amongst dental disease and their specialty practices the medicos are maintaining. I think we'll have to walk that extra mile ourselves now to get those meeting the end goals for our patients. Thank you very much, Dr. Vinod. I think we will run out of time for this, but I will take one last question. Dr. Charubala, we see that due to erratic working conditions, time management for balancing work, health and fun has been a challenge for dental professionals. How would you set your goals to be happy and a fit dentist?
That is a very light-hearted but very important question. I think all of us as dentists have this issue. We either land up spending too much of time in our clinics and have occupational hazards like backaches and spondylitis and all that, and we forget to have fun. Or, some people, unfortunately, they give up the profession altogether and go into something else. So I would like to say there are 4 or 5 things which are very important in having a proper work-life balance. One thing is a good communication with your team who are there in your clinic. Every morning when you go, you meet your associates, you meet your co-workers, discuss with them what cases are going to be there for the day, discuss if there is going to be any particular, material stock out or any equipment, rundowns, any issues or challenges which have to be addressed before you start your day. That will ease out a lot of issues. You can in fact, you can fix a particular day, maybe like Wednesday, when things are a little slow. They'll keep 1 hour slot where you make a list and indent and see that all your, you have a buffer maintained for your material, that your equipment is serviced properly, etc. That takes care of a lot of headache. Second thing which I would like to say is that this is especially for female dentists. I have been in NABH traveling a lot, managing my practice and my family. So, I would say leave your work at your workplace and leave your home at your home. When you are in your clinic, when you are doing your assessments, don't think about your family. There are other people to take care of it. When you are working, think only of your work. But when you are at home, don't take calls beyond your time unless there is an emergency. There are other people to handle it. Delegate your responsibilities, both clinical and administrative. And that's how you can lead a content life. and always have time for your hobbies and all the things that you think are fun, because life is too short and we have to do all of it in this lifetime. Thank you.
But would you recommend a forced vacation every year
Post
for
vacation, yes, I would recommend 2 if possible, but at least 1.
luxury? Thanks a ton. I think I must thank Kao for having given us this time for this discussion out of the presentation that we did. And I must thank my panelists, Dr. Supreeth SM, Dr. Charubala Pavan, Dr. Vishwas Puranik, and Dr. Vinod Singh for being a part of this panelist. And of course, I just urge you that if there are some questions from our delegates today, take out little time and answer them for at least next 1 week. Okay, thanks the organizers once again for this opportunity. I hand over my talk back to the MCs.
Thank you, sir. Thank you, Shetty, sir. And thank you all the panelists for the insightful session. Now we had come into the end of today's session. And for that purpose, I would like to request Dr. Arjun KR for delivering the vote of thanks. So I would introduce him with his brief introduction. Dr. Arjun is the founder and CEO of the Dentocrest. He had completed BDS and Masters in Hospital Administration, and he is having 15 years plus experience in the field of quality management system for various healthcare facilities. And he is the member of Technical Committee for Dental Accreditation Standards at QAI. And he is the National Coordinator for CGHS, ECHS Dental Facilities, EC member, Joint Secretary for AHPI India. And he is also the National Representative for Dental Facilities Governance Committee of CAHO. So I welcome Dr. Arjun KR for delivering the vote of thanks. Over to you, Dr. Arjun, please.
Thanks a lot, Devadatta. So very good evening, everyone. On behalf of the Governing Committee of CAHO, I'm extremely happy to thank everyone for taking the time to participate in this event today. So we would also like to extend our thanks to ASQA, that is Asian Society for Quality in Healthcare, to its president, all board members, and ASQA for collaborating with CAHO in presenting this continuing quality education series every month. So we have representation from Dr. Jayarajan Pillai. Thank you, sir, for that. We wish to thank all the speakers for today's session, Dr. Charubala ma'am, Dr. Vishwas sir, Dr. Tushar Chawla sir, Dr. Supreeth sir, and Dr. Vinod Singh for taking the time to share their knowledge and expertise with the broader audience. We had great sessions with experienced speakers and received excellent feedback from all the delegates. I would also thank the patrons of CAHO and the governing body members of CAHO who have contributed to the success of this program. I also thank the organizing chairman of today's program, Dr. Sharat Shetty sir, and the organizing secretaries, Dr. Anna George ma'am, for compiling today's 3-hour session in an admirable manner. Ms. Devadatta Das and Archana Shahi have been great MCs for the afternoon, leading us as we transition through the sessions. Thank you very much. The staff at the CAHO Secretariat have been providing consistently strong support in all our activities, so our thanks to them. I would also like to express our thanks to our fellow leaders of Quality Professional Wing of CAHO, Dr. Anuradha Pichumani ma'am and Dr. Subin Shetty, who helped in coordinating this CQE series. For the strong visionary leadership and support from CAHO President, Dr. Vijay Agarwal sir, and Secretary General, Dr. Lallu Joseph ma'am, and for their much valued and timely inputs in shaping the program. I thank them. And finally, the delegates, my heartfelt thanks to the delegates. Thank you very much for your engaging participation in the sessions. We hope you find them helpful in your practice. Thank you, and very good evening to everyone.